Clark, you said you aim to do this for gene therapy. It's not there yet?
In the U.S., there are no currently approved. I think that still holds as of today. There are a couple in Europe, but it's very early on. Our products are in development, but we're already thinking ahead and trying to plan for the system impact. MIT has the New Digs initiative, which is focused on thinking through different approaches for payment models. There are other initiatives that we're part of through our CEO's efforts. So it's something, yes, that we're trying to think ahead of and plan for now.
Well, in the planning stage, can you tell us what it would look like? What you would offer in exchange for the price that you plan to charge?
Yeah, so we can't get into a lot of details, but in discussions, especially with Europe, because we actually will be involved in Europe as well as the U.S., gene therapies are likely going to be required from a safety registry perspective to be, patients are going to have to be followed probably for a minimum of 10 to 15 years. So we're looking to set up adjudication processes where the outcomes that we think are the value-based outcomes can actually be collected in those registries and adjudicated, and making sure that we have incentives for long-term follow-up, because for some of these transformative therapies, they potentially may not need to visit the hospital or visit the doctor after 4 years. They may be, the word cure is tossed around, and we try not to use that lightly. They may not need to go back to the doctor. How do we make sure that we're ensuring that they're okay and that they are hitting the outcomes that the payers and the national systems in European countries want to make sure that they paid for, and that as part of that value agreement? So we're trying to think through the data collection and evidence ability to collect that and adjudicate that, because that's what Michael and others are going to need to make sure that we're backing up our end of the contract.